We're going to see an inability of people to access services.
I'm Joanne Montes.
My name is Matt Appleman.
My name is Wendy Kelly.
My name is Peter McLeod.
The AIDS Drug Assistance Program has been a program that this committee has watched flourish in the state of Illinois over the last decade. There is great interest in it because it is a unique model in that it's designed to keep people who are living with HIV in the workplace and be taxpayers, and it's designed to attempt to keep people off Medicaid rolls and keep them working and healthy.
My name is Matt Appleman, and I am with the Illinois Alliance for Sound AIDS Policy. I am a small business owner in Dixon, Illinois, and I am a homeowner, and I am a father. As a small business owner, I had to look for private insurance. Because of my HIV status, I am unable to obtain insurance and have been denied. Currently, my HIV medications cost $57 a day. That's $20,640,000 a year. That comes to 2/3 my annual gross income. My fears are that if current funding is not maintained, that I would not have access to medication. If this happens, I would be back to being very sick. I would have to close my business, and I would be totally reliant on the Medicaid system.
Eric Buckles. I'm here to testify on behalf of my experience as a recipient of the AIDS Drug Assistance Program. I've been HIV positive for as long as 13 years. Okay. I've been a recipient of the AIDS Drug Assistance Program since March 2005. This experience has been life-saving and changing. I think Illinois has done a phenomenal job with the AIDS Drug Assistance Program. It's assisted me in many ways as a result of my adhering properly to the medications that I receive through ADAP. I am no longer homeless. I am stably housed. I'm employed. I've only had a great experience with this program. I would love for the board to know that this program is extremely important to survivors of HIV and AIDS. Without this program, the state would be in trouble.
I think, first of all, listening to the consumers, these stories are typical, whether they're people in Chicago and the collar counties. I am the executive director and medical director of a freestanding nonprofit AIDS service organization in Joliet. So I'm outside of the Cook County area in the collar county, and I think meet some of the same, or have some of the same challenges as many of the downstate agencies have. But the client needs as presented are very, very similar. What it takes to meet those needs may vary dependent upon where we are. And I think just to emphasize, Eric is an example of the person that comes in, needs ADAP to turn his life around. It doesn't mean he will stay on ADAP for his entire life. ADAP and the Ryan White programs were created as a safety net. And that safety net was to help the uninsured, underinsured individuals until they were able to either get onto an entitlement program, which they were eligible for, or until they were able to get into the insurance system and back on their feet. So I think Eric is an example of the success story of what ADAP can accomplish with the Ryan White programs. Matt is...
Well, I have been a recipient of these services on and off for the past 10 years, for pretty much the time that I've been HIV positive, and it scares me to think of what can happen to this program. There are so many people being enrolled since last year, and that speaks of two things. It speaks of the increased need for drugs for people living with HIV. It also speaks of the great efforts that we're having with testing and counseling. But I also have to mention the financial crisis that we're living in. That's the reason I'm a participant of the program now. I'm not insured. I've been healthy for the past 10 years thanks to the HIV drugs, but in order for me to continue to stay healthy, I need to continue to take these drugs on a consistent basis. So being uninsured at the moment means that I have to participate in the program, and I can just imagine how many other people are in the same shoes that I am. And
my name is Kurt Hicks. I'm the Regional HIV Prevention Coordinator with the Cook County Department of Public Health. This year, 60% of that funding, which was state dollars, have been entirely cut. 2 out of $3 for HIV prevention are gone. That 2 out of 3 HIV tests gone for very high-risk folks. 2 out of 3 partners of positives won't be notified of their exposure and get counseled and tested for that. That means that 2 out of 3 risk reduction sessions, groups for very high-risk people, homeless youth, gay men, injectors, high-risk women, won't happen. Budget shortfalls have forced the Illinois Department of Public Health to cut HIV prevention state dollars entirely in order to pay for HIV medications. And I understand that critical need, but this is a vicious circle. Without prevention, more vulnerable people will be infected. And if more vulnerable people are infected, then care costs are going to spiral out of control. And so we're not going to have ended up solving our problem at all. We need minimum allocations for HIV prevention and for care. And we need revenue reforms to make sure that Illinois has adequate resources to pay its bills and to keep its citizens healthy. Take the bold steps needed to raise revenues to make sure that these vital services are continued.
if we want a healthy state, we need healthy people, and to have healthy people, we need these medications. To have these medications, we need funding to be injected into the ADAP program.
Please save this program.
By keeping the funding to ADAP, I will be able to continue to work and pay taxes. We all have a stake and a responsibility to funding and preventing HIV in the state of Illinois.